Welcome to our video on airway management in the ICU. Airway management is a critical aspect of care in the ICU. Patients in the ICU often require advanced airway management techniques to ensure that they can breathe properly and receive the oxygen they need to survive. The first step in airway management is to assess the patient's airway to determine if it is patent or open, and if it is adequate for the patient's needs. If the patient's airway is not patent or adequate, the healthcare provider will need to take steps to open or maintain the airway. One of the most common methods of airway management in the ICU is the use of an endotracheal tube, or ET tube. An ET tube is a tube that is inserted through the patient's mouth or nose and into the trachea, or windpipe. The tube is then connected to a ventilator, which provides the patient with oxygen and helps them to breathe. Another common method of airway management in the ICU is the use of a tracheostomy tube. A tracheostomy is a surgical procedure in which a hole is made in the patient's neck and a tube is inserted through the hole into the trachea. This tube can be connected to a ventilator or other breathing apparatus, and it allows the healthcare provider to directly access the patient's airway. In addition to these advanced airway management techniques, healthcare providers in the ICU may also use various other devices such as laryngeal mask airway, supraglottic airway devices and non-invasive ventilation methods. It is important to note that airway management is a dynamic process and healthcare providers must continuously monitor and reassess the patient's airway to ensure that it remains patent and adequate. Any change in the patient's condition can require a change in the airway management plan. In summary, airway management is a critical aspect of care in the ICU. Patients in the ICU often require advanced airway management techniques to ensure that they can breathe properly and receive the oxygen they need to survive. Healthcare providers in the ICU use a variety of methods and devices to maintain the patient's airway, including endotracheal tubes, tracheostomy tubes, and various other devices. Continuously monitoring and reassessing the patient's airway is crucial to ensure that it remains patent and adequate. Thanks for watching.